neglect here, because as I've written about as well, the history of hemp in America is fascinating, knowing that our founding documents were written on hemp paper, the Declaration of Independence, the Constitution, and in fact, our founding fathers grew hemp. And there was a point during World War II era that we were almost, that there were public service television ads, radio ads to plant hemp for the war effort. And somewhere after that is when the industrialists decided we need a monopoly on certain flows in certain areas and industries that we have access to, and that hemp poses a threat to them. So if people have the mystery as to why, or the question as to why we abandoned this plant, if they are under the impression that it was because of the psychoactive aspect of cannabis, the THC, that was really not the reason for it. It really was an economic issue. And not only I mentioned previously with the William Randolph Hearst and the newspaper empire, the trees that would turn into paper, but you have a lot of the textile industry threatened by hemp. Cotton is threatened by hemp. You have oil, of course, the uses of oil, all of the petrochemicals that ended up into other products. Hemp is a wonderful botanical, let's say, origination point.
I think there's 25,000 different possible uses for the hemp plant. I mean, it used to be, there were some American colonies. Actually, there was a law that you had to grow hemp, otherwise you'd get in trouble.
Yeah, and then if we look, Dr. Bradstreet, into your arena, the pharmaceutical arena, we say, my goodness, how many potential areas could it threaten a drug monopoly? A pain management, pain medication, very strange addictions or powerful addictions that are dangerous and often deadly, liver toxicity issues with it. We have the psychiatric medicines, the SSRI potential, the anti-anxiety drugs. Now we're talking also seizure medicines, anti-seizure drugs. This is just one aspect of it, but these are very large industries, multi-billion-dollar industries that do not like competition. So we have to acknowledge that behind even medicine is this economic imperative to maintain a stranglehold on a monopolistic practice, again, the drug pipeline that you acknowledge is kind of drying up. They've run out of innovative new drugs, and so now the medical practitioner, the doctor, has to now embrace once and for all, and I think this is a good thing, that botanicals may be an optimal way and that drugs should be the way as the last resort. When we have no other way, then we know that they're there, as opposed to where they've been for a long time now as the first resort.
Well, there's a very interesting substance that's available in Europe, but not available in the United States, called PEA. Now, this is not phenylethylamine. It's not that product. They use the same abbreviation for a precursor fatty acid to the endocannabinoid pathway as an over-the-counter food medicine type of a product. And because I work a lot in Italy, I'm aware of this substance. So it's called palmitoethanolamide. PEA, palmitoethanolamide. And it has this huge body of literature showing that it can very adequately stop chronic neuropathic pain. So people that have diabetic neuropathy, people who have a disc injury with a burning sensation in their leg, people with chronic pain syndromes. This is an endocannabinoid precursor ligand that is already approved in Europe. You can walk into your corner pharmacy and buy it without a prescription, but it's not available to people in the United States. So we actually have in Italy an ongoing research process to look at the potential applications of this fatty acid substance to autism as well. And we'll be starting off with cell viability and cell transcriptomic type of studies in Ity prior to the application to children, but it looks extremely safe. There's no prescription required. And the real question is, why don't we have it in the U.S.? Why is this natural fatty acid not available to us? And the simple truth is the cost to bring a natural substance to market in the U.S. is probably at least $50 million. For a natural substance to come to the market in the U.S. and make a claim that it can treat something, $50 to $80 million is the estimate from the natural health industry that's trying to get changes into the FDA regulations. But it's tough right now to bring very helpful, natural, safe things into the U.S. market for the U.S. consumers to use.
Well, I see that the model is going to have to shift, and we've seen that in the United States, while the states once again recognize the 10th Amendment to the Constitution, which provides for nullification of federal laws when the federal government has no authority granted to it, enumerated to it specifically in the Constitution, like the banning of this plant. As we've seen, 22, 23 states and climbing have now made legal in various ways or levels the CBD, of course, but also the THC form and the different varieties of cannabis. So if we move forward into this, we look at your profession, again, the medical profession. I assume that at Autism One, your colleagues were very open and receptive, but there's that larger body of allopathic medical doctors that are maybe not as open yet, or maybe they are. Have you presented at, let's say, more generalized medical conferences and seen that you've been embraced, or are you still maybe shunned a little bit because they're afraid to be aligned with the plant still?
No, actually, I was just at a very large scientific congress that convened here in Atlanta, IMFAR, which is the International Meeting for Autism Research. And while there, I spoke to directors of immunology at major medical schools from the United States and around the world. And the immunological interest in the endocannabinoid pathway is really exciting and growing. So as an example, for the treatment of multiple sclerosis, there's a large body of literature that now supports its application to multiple sclerosis, and research going on at several U.S. medical schools for the application of hemp-derived oil products for the treatment of multiple sclerosis. So with that as kind of an open door to look at its potential application in autism, there was a lot of interest. And the reason there's a lot of interest in this in the autism arena is there is no effective therapy from the pharmaceutical industry for the treatment of autism. It's not like we're competing with a drug out there. The couple of drugs that are approved for the treatment of irritability in autism don't treat autism. They just make the kids less irritable, and they have huge potential side effects. These are major antipsychotic medicines that can have permanent lifelong disability as a consequence of their use, and that's it. That's all there is. There is nothing else approved by any drug company or anybody else that says this treats autism. So there's this vacuum that desperate parents and concerned physicians are trying to fill with some creative ways, with some varying results. I mean, there's some very good responses to things like CBD and hemp oil products, where the seizure activity reduces, the abnormal stereotypy is reduced, where the kids start to become more connected, start to join the world around their parents. I think the myth that's still associated with the hemp plant is that its use is going to make you a stoner, it's going to make you lazy, it's going to make you inactive, you're not going to be able to think, you're not going to be able to function, you're going to just be laying around bumming off your parents, man. The reality is that the proper application of it is, it's really hard not to go back to the hippy dippy mailman. I'm old enough to remember the hippy dippy mailman. So those of you who know George Carlin, he was quite a character. Kind of lent that sort of affect to the possible use of marijuana, and that's where the proper application of the right sort of blend of cannabinoids can be phenomenal, but we're a long ways from fully understanding how to do that. And so many physicians are absolutely paranoid that that the hemp oil products are still regulated in the same way that medical marijuana is. And if they're not in a medical marijuana state, they're very concerned about that.
Sure.
Yeah, I think it's just a matter of education. You know, people need to learn about what it is and what the difference is, as you said, between the CBD and the THC, which, you know, there's education needs to go on there. Here's one question I was wondering if you could answer. If CBD helps regulate the endocannabinoid system, we've talked about how it does that. Is it possible then that CBD may be able to reduce the amount of prescription medications that people are using?
I don't think there's any question that that's a possibility. We've seen, I'm licensed in California, which is a medical marijuana state. So I have a lot of experience with the California crop of patients that I have, no pun intended, where we see children be able to either reduce the amount of anti-seizure medications or get off them completely, children able to reduce their dependency on psychotropic drugs or get off of them completely through the appropriate use of these kind of blends of different cannabinoids. And it's a very specific child sort of driven intervention. not every child, it's not like one recipe fits every kid with autism, nor does one recipe fit every individual with chronic illnesses or chronic pain or cancer or whatever they may have. So that's where a lot of people who have been working with medical marijuana, as in California for a long time, have a lot of expertise and experience, and we need to draw upon that to start to design better studies to help us be guided in a more appropriate way to make recommendations for people.
Yeah, well, the thing is it's interesting. Statistics show that a person dies every 19 minutes from a prescription drug overdose. And I don't think there's been a documented case of any type of medical cannabis overdose anywhere. And so that's, getting people off those prescriptions or the prescription drugs is obviously going to save lives. Actually, one of those things, one of those things that people are taking prescription drugs for is inflammation. Mm-hmm. Now, inflammation is a problem on its own, but inflammation has a tendency to also then lead into other ailments and diseases from there. What does CBD do with inflammation? How does it affect inflammation?
So let's take hemp oil as a bigger picture rather than just CBD. So CBD is cannabidiol. It's a specific component of hemp oil, but I don't want to give up on things like beta-caryophyllene and things like that. So we'll take two constituents of hemp oil rather than and not focus on the other 45 to 60 things that are there. So right. If you look at CBD plus beta-caryophyllene, we have two very powerful molecules that regulate inflammation in amazingly intense ways. So when we use the word inflammation, we can attach to that type 2 diabetes, almost all autoimmune diseases, including type 1 diabetes. Nearly all cases of heart disease, certainly vascular heart disease, is almost always an inflammatory process. Nearly all neurodegenerative diseases, Alzheimer's, Parkinson's disease, ALS, MS, all find their roots in improper immunological regulation. Inflammatory bowel diseases like Crohn's and ulcerative colitis, rheumatoid arthritis, chronic myopathic pain syndromes like fibromyalgia and chronic fatigue syndrome all find their root in the same dysregulation, the same inflammatory change. So at the root of almost all chronic illnesses, and probably cancer is a chronic inflammatory disorder as well, but at the root of nearly all chronic illnesses that the healthcare consumer spends billions upon billions upon billions of dollars supporting the health-related industry is this same common pathway that we are using things like non-steroidal anti-inflammatory drugs by the ton. I mean, we use those kinds of medications. Like it's an entire row of a pharmacy are the various choices you have for non-steroidal anti-inflammatory medications. Behind the counter at the pharmacy, numerous prescription medications that are anti-inflammatories, steroids and other agents. And you see all these new novel things that are TNF binders that are trying to get at the inflammation system. So there's a huge pharmaceutical market attempting to address this particular problem with very little evidence that the outcome from these chronic diseases is being modified in a favorable way. So that particular solution at this point in time doesn't seem to be working very well for us because, quite honestly, we are sicker now than we were 30 years ago when I was in medical school.